Joining me now for Facts Over Fear is Dr. Lipi Roy, an internal medicine physician and an MSNBC medical contributor. Doctor, it's good to have you with us, as always. Let me talk a little bit about that report that we were just hearing there, because in the U.S. you have several states that are announcing major new efforts to ramp up contact tracing. One of them is a partnership between New York, New Jersey, and Connecticut, the tri-state area. Why is this an important step towards reopening, and can it be an effective method without testing being scaled up significantly?
Good morning, Ayman. It's great to be with you again. So contact tracing has been used. It's a tried and true method that's been used in public health since the dawn of time. Ever since we've had infections and pandemics and epidemics, we've had contact tracing. We need actually widespread testing side by side with contact tracing in order to really end this pandemic. Both are going to be critical at ending the pandemic. At least with contact tracing, you identify who's infected, but that's where you're going to need testing to identify who's infected, and then reach out to the people that they've been in contact with, and let these contacts know, this is what's going on. Use a compassionate approach, inform people why you're advising them to stay at home, and find out what resources they need, because this is something they're going to need to do for the following weeks in terms of staying home. Do they have resources, food, clothing, things like that? But both are going to be critical to ending the transmission of this disease.
There's no doubt that this pandemic has posed a series of ethical questions to doctors and now even to politicians. The New York Times has an article looking at, quote, the cold calculations America's leaders will have to make to reopen. It says without a vaccine or a cure, officials are facing likely deaths after their decisions to reopen businesses. I'm curious to get your thoughts on this. As a doctor, what do you say to that? Is that an inevitable situation we're going to find ourselves in?
The truth is that right now, look, you and I, we all are really in agreement that, yeah, of course we want businesses to reopen. I want restaurants to open. I want to go back to all these things and Broadway and hockey games. I want to do all that too. But I want to do it when it's safe to do so. Remember, you can't run a business with sick and frankly dead people. You just can't. I hate to be that blunt, but that's what it's coming down to. We've seen what this health issue has done. This virus has unleashed social and economic devastation that will continue if we don't get a strong handle on the disease. That is by testing, diagnosis, treatment, and keeping people isolated and safe until, as you pointed out, Ayman, we have treatment and a vaccine.
And let me ask you, as we continue to learn more about this every day, about this pandemic, specifically about this virus, it feels like there are more possible complications or symptoms of the coronavirus. In fact, the Washington Post put it this way. It is out with a new article on a mysterious blood clotting complication killing coronavirus patients. Obviously, you speak to a lot more doctors than I do. Is this something that you've been hearing firsthand about?
Yeah, Ayman, I talk to doctors every day, every hour. But yeah, to your point, Ayman, we are learning really fascinating things about this virus that we did not see with other viruses, certainly not with other epidemics. There's a certain chronicity about this virus. Not only is it acute, but there's a chronic nature in terms of the different complications. Remember, there have been cardiac complications with myocarditis, definitely the respiratory ones, neurologic, but now we're seeing clotting. I've had fellow colleagues text me, email me, call me weeks ago saying that they're seeing clotting in the tubing, IV tubing. We're seeing clotting in the lungs, in the legs. Somebody had to get an amputation. We're not really sure what the pathophysiology is, nor do we know what the treatment is, but we need a lot more studies, large trials of patients. A Dutch study looking at 184 COVID-19 ICU patients saw that 20% of them had clotting issues. So we need to do a lot more investigation to understand what exactly is going on.
We're obviously in a state where the society is obviously very paranoid right now going to a hospital, given the fact what is happening there. I know that hospitals are also reporting a dramatic drop in the number of patients with things like heart attacks and strokes. Those things have not stopped happening in our society. But when you look at the fact that the numbers have dropped, What is your advice to people who are afraid to make what they believe are non-coronavirus related trips to the hospital?
Yeah, Ayman, thank you so much for asking that question. This is really key. Heart attacks and strokes, I guarantee you, are still happening. There's no reason for them not. In fact, if anything, stressful environments are a risk factor for a rise in heart attacks. What I'm concerned about, well, a lot of healthcare professionals, including Dr. Harlan Krumholz, I think, from Yale, who's been studying this, published this. What we're concerned about is that people are so scared of coming to the hospital that they're either ignoring or they're not able to identify what are acute symptoms. And I want to make sure the public understands, if you're having what we call an acute symptom that could be something like a cardiac, heart, or a stroke, this is what you need to know. If you're having chest pain, discomfort, fullness that's not relenting, that's not going away, or it's pain that's going down your arm or up your jaw, call your doctor. This could be a heart attack. Not necessarily, but it could be. And if you're having, think of FAST, F-A-S-T, if you're having facial drooping, arm weakness on one side, or speech or vision difficulties, T, it's time to call 911. It could be a stroke. So these are the acute symptoms I want people to know about, and call your doctor or call 911 if you're having any of these symptoms.